never shied away from tough decisions. And today, I'm here to do just that. My friends, we're losing the battle between the variants and vaccines. The pace of our vaccine supply has not kept up with the spread of the new COVID variants. We are on our heels. But if we dig in, remain steadfast, we can turn this around. We're down, but no means are we out. In the last few weeks, you've seen me up here every day. We've been ringing the alarm bells for weeks. We pulled the emergency brake for the entire province. We shut down our schools. Most of the province has been in some form of lockdown since last fall. We announced a second stay-at-home order for all of Ontario. And as we saw in the modeling, these actions have slowed the spread. They've reduced mobility and avoided the worst case. But we have to do more. The reality is there are few options left. We have implemented the strictest measures in all of North America. And the difficult truth is, every public health measure we have left comes with a massive cost to people and their lives. But we have never shied away from doing what's necessary. And it comes down to three things: limiting mobility, enforcing the rules, and getting vaccines into arms. And as your Premier, it falls on me to make the difficult choices. It falls on me to do what's necessary. So effective immediately, we're extending the emergency declaration and prolonging the stay-at-home order province-wide for an additional 2 weeks, for a total of 6 weeks. Outdoor gatherings will now be strictly limited to members of your own household only. Anyone who lives alone can join with one other household. We'll be closing all non-essential construction. We're restricting all outdoor recreational amenities, such as golf courses, basketball courts, soccer fields, and playgrounds. We're reducing capacity in big box retail even further to 25%. Beginning on Monday, places of worship will be capped at a maximum of 10 people indoors. To get ahead of the variants that are plaguing Western Canada, beginning Monday, we're setting up checkpoints at all interprovincial borders. We'll be limiting access to border crossings between Ontario and the provinces of Manitoba and Quebec, with exceptions such as work, medical care, or transportation of goods. And we're calling on the federal government to immediately tighten up our international borders. We're currently facing the devastating consequences of COVID variants that entered Canada through our borders at the start of this year. We need to do more to stop other, even deadlier variants from getting into Canada and causing more havoc. That means limiting air travel, tightening up our US border, and addressing the countless issues we're seeing with testing and quarantining when people fly into our country. Every week, over 36,000 people from all over the world come through Pearson International Airport. The variants that are causing this inferno, they got in through our borders. And more needs to be done right now. For our part, we are taking decisive action on the ground to dramatically step up enforcement. We have made the difficult but necessary decision to give police and bylaw officers special authorities to enforce public health measures for the duration of the stay-at-home order. I know that the majority of Ontario residents are doing the right thing. They're following the rules, keeping each other safe. but we need to step up enforcement. We need to focus on those who are deliberately putting others at risk by ignoring the stay-at-home order. Those gathering in large groups, continuing to put themselves and others at risk. So understand the restrictions will be strongly enforced because they must be. We know that when they're followed, these measures work. They reduce mobility and they do flatten the curve. We know this because we've seen them work before. What we need now is for everyone to follow these rules. These variants are infecting and killing younger people every day. We need more time to continue vaccinations to priority populations because getting needles in arms will help put this pandemic behind us. Through no fault of their own, certain communities are waging a bigger battle than others. 20% of the province has 80% of cases right now. We need to use the limited vaccines we have to focus on the inferno, because we will all benefit from getting these areas under control. That's why we're increasing vaccine supply to hotspots by 25%. And we're pressing the federal government to get us those shipments. Every vaccine we receive goes into an arm. Every single one is spoken for. We have seen clinics close and turn people away because we don't have the supply we need. And just today, we learned about a further Moderna delay. And we clearly saw in the modeling, more vaccines means fewer cases. More vaccines mean fewer hospitalizations. And more vaccines means we get out of this sooner. So if there's anything at all the federal government can do right now to get us more vaccines, we need to get them now. I can't emphasize that enough. We need the vaccines now. In the meantime, we're taking immediate action to build unprecedented capacity in our hospitals. We're moving forward with our emergency plan to add another 700 to 1,000 new beds. We don't want to have we don't want to use this new capacity, but I want the people of Ontario to rest assured it is there if we need it. And it's been remarkable watching our healthcare heroes fighting on the front lines. And I want them to know that more help is coming. And each of you have the most important role to play. Please stay home, follow the rules, and get your vaccine as soon as you're eligible. My friends, you have my word. We will not rest until this virus is beaten. Thank you, and God bless the people of Ontario. Now I'll pass it over to Ministralia.
Thank you, Premier. Like many provinces across Canada and jurisdictions around the world, Ontario is in the midst of the third wave of COVID-19. And as we've seen, this wave is different. Over the last few weeks, key health indicators have continued to worsen. COVID-19 cases, hospitalizations, and intensive care unit occupancy are at their highest levels since the start of the pandemic. Variant cases, which are transmitted more quickly and easily, continue to rise, putting even more lives at risk. And while we continue to use every resource at our disposal to support our hospitals and maximize health system capacity, our hospitals are being hit harder than ever. In 1 week, the number of COVID-19 hospitalizations has increased by almost 30%, and there are about 150 more patients in our intensive care units, bringing the total to 701 intensive care unit patients with COVID-related critical illnesses. The latest projections released show that admissions to ICUs are projected to rise to over 1,000 patients by the end of the month. And today's highly concerning modeling is very clear that unless further actions are taken, case rates will continue to rise, pushing our hospitals to the brink. Our response needs to be stronger because our opponent, the variants, are that much stronger. That is why we are taking immediate action to respond to the ongoing threats to the health and safety of Ontarians. Effective Saturday, April 17th at 12:01 a.m., all outdoor social gatherings and organized public events will be prohibited except for members of the same household or members of a household and one other person from outside that household who lives alone. All non-essential workplaces in the construction sector will be closed, with only essential construction permitted to operate. Capacity limits for in-person shopping in all retail settings where in-person shopping is permitted, including supermarkets, grocery stores, convenience stores, and stores that primarily sell food and pharmaceutical products, will be limited to 25% capacity. All outdoor recreational amenities, such as golf courses, basketball courts, and playgrounds, will be closed. In addition, effective Monday, April 19th at 12:01 a.m., capacity at weddings, funerals, and religious services will be limited to 10 people indoors or outdoors. Drive-in services will be permitted. All other public health and workplace safety measures for non-essential retail under the province-wide emergency brake will continue to apply. We know the way out of the pandemic is vaccines. That's why we are taking further action to support hotspot communities and focus on getting the vaccines to those who are most at risk. As part of phase 2 of our government's COVID-19 vaccine distribution plan, we are committed to dedicating 25% of future vaccine allocations to the 13 public health regions with historic and ongoing high rates of death, hospitalization, and COVID-19 transmission. While the greatest challenge to Ontario's vaccine rollout remains a stable and reliable supply of vaccines from the federal government, we will continue to focus our vaccination efforts on those most at risk, working with our valued community partners and local public health units to mobilize every channel and deliver vaccines as quickly as possible. All Health Canada approved COVID-19 vaccines are safe, they're effective, and I strongly encourage everyone to sign up to receive the vaccine when it's your turn. I know it's been a longer winter, but now our summer is at risk. I am asking all Ontarians to please stay home to stop the third wave from threatening our healthcare system and the health of thousands of Ontarians. We may not feel it, but brighter days are ahead. They may not come as fast as we would like, but we will get there. And it will take a collective effort from all of us. Thank you. And I'd now like to hand it over to the Solicitor General.
Thank you, Minister Elliott. As both the Premier and Minister Elliott stated, COVID-19 projections are moving in a dangerous direction across Ontario. With our hospital system experiencing devastating pressures as a result of sharp upward trends in hospitalization and intensive care unit capacities, it is essential that people respect the stay-at-home order and follow public health measures. This is a critical moment in Ontario's response to this deadly virus, and every single person in Ontario has an important role in protecting our communities. Unfortunately, some people continue to attend gatherings and leave their homes for non-essential reasons. As a government, it is our responsibility to take action to address non-compliance and prevent further transmission of COVID-19. That is why, after consulting with public health experts, we have made the deliberate decision to temporarily enhance police officers' authority for the duration of the stay-at-home order. Moving forward, police will have the authority to require any individual who is not in a place of residence to, first, provide their purpose for not being at home and provide their home address. Police will also have the authority to stop a vehicle to inquire about an individual's reason for leaving their residence. I cannot stress this enough. It is imperative that everyone limit their trips outside of the home to permitted purposes only, such as going to the grocery store or pharmacy. medical appointments, outdoor exercise, or for work that cannot be done remotely. We know that stay-at-home orders work. We've seen their success in slowing down the spread of the virus and saving lives. It is also critical that we protect against COVID-19 variants coming into Ontario through non-essential travel. That is why, effective April 19th at 12:01 a.m., we are restricting travel into Ontario from the provinces of Manitoba and Quebec, with the exception purposes such as work, medical care, transportation of goods, and exercising Indigenous treaty rights. Should an individual not have a valid reason to enter Ontario, they will be turned back. These are tough but necessary measures to help us overcome this health crisis. We all want to get back to normal, but we can't get there without all doing everything we can right now to stop the rapid spread of COVID-19. Together, we can make a difference to protect our loved ones and our communities. Please stay home, stay safe. Thank you. I will now turn it over to Minister McNaughton.
Good afternoon. As we continue our fight to defeat this deadly virus, it's crucial that we do everything possible to keep workers safe. Since the start of this pandemic, we've now done over 46,000 COVID-19 related inspections, issued more than 49,000 orders, and stopped unsafe work 87 times. Our efforts have been laser focused on where they are needed the most, with blitzes in hotspot regions targeting hundreds of big box stores, factories, and warehouses. In order to help reduce spread, we are shutting down some non-essential construction like shopping malls, hotels, and office towers. However, there are still projects that are critical to our health, like building our homes, our hospitals, assessment centers, and long-term care homes, and we need to ensure those on these sites are being kept safe. Starting today, over 200 inspectors are visiting more than 1,300 construction sites over the next 4 weeks to ensure public health measures are in place. Travel to and from work has been a major contributor to the spread of this deadly virus. For that reason, we have repeatedly asked people who can work from home to do so. The sad reality is more and more people are being asked to go into the office. This cannot continue. That is why our inspectors will be visiting law offices, accounting firms, and other workplaces over the coming days and weeks to make sure that those inside and on-site are protected and following the COVID-19 safety requirements. I cannot stress enough to employers, if your staff can work from home, they must work from home. And our inspectors will also be ensuring that those who absolutely must come to work are strictly following the public health measures. For our employers and employees, take note, this is your last warning.